I'm Samantha Bryan, and I did mental illness in women. Mental illness is a major issue that is affecting women today. Women are reluctant to seek treatment due to various reasons. Without treatment, the consequences of mental illness for the individual and society are staggering. Unnecessary disability, unemployment, substance abuse, homelessness, inappropriate incarceration, suicide, and wasted lives. The economic cost of untreated mental illness is more than $100 billion each year in the United States. A mental illness is a condition that impacts a person's thinking, feeling, or mood, may affect his or her ability to relate to others and function on a daily basis. Each person will have different experiences, even people with the same diagnosis. According to the Mental Health Foundation, 1 in 5 adults experiences a mental health condition every year. 1 in 20 lives with a serious mental illness such as schizophrenia or bipolar disorder. In addition to the person directly experiencing the mental illness, family, friends, and communities are also affected. 50% of mental health conditions begin by age 14, and 75% of mental health conditions develop by age 24. The normal personality and behavior changes of adolescents may mimic or mask symptoms of mental health conditions. The National Institute of Mental Health says that mental illnesses affect men and women differently. Some disorders are more common in women, and some express themselves with different symptoms. Women are more likely to have been treated for mental illness. Depression is more common in women than men, and women are twice as likely to experience anxiety than men. The World Health Organization says that gender-specific risk factors for common mental disorders that disproportionately affect women include gender-based violence, socioeconomic disadvantage, low income and income inequality, low or subordinate social status and rank, and unremitting responsibility for the care of others. On the whole, women are paid less, find it harder to advance in a career, have to juggle multiple roles, and are bombarded with images of apparent female perfection. Women are also much more likely to have experienced childhood sexual abuse, a trauma that is all too often resulting in lasting psychological damage. Gender differences exist in patterns of help seeking for psychological disorders. Women are more likely to seek help from and disclose mental health problems to their primary health care physicians, while men are more likely to seek specialist mental health care and the principal users of inpatient care. Gender stereotypes regarding proneness to emotional problems in women and alcohol problems in men appear to reinforce social stigma and constrain help seeking along stereotypical lines. They are a barrier to the accurate identification and treatment of psychological disorders. At least 1 in 5 women suffer rape or attempted rape in their lifetime. Depression, anxiety, psychological distress, sexual violence, domestic violence, and escalating rates of substance abuse affect women to a greater extent than men across different countries and different settings. Pressures created by their multiple roles, gender discrimination, and associated factors of poverty, hunger, malnutrition, overwork, domestic violence, and sexual abuse combine to account for women's poor mental health. There is a positive relationship between the frequency and severity of such social factors and the frequency and severity of mental health problems in women. Severe life events that cause a sense of loss, inferiority, humiliation, or entrapment can predict depression. According to the National Alliance on Mental Health, borderline personality disorder is a condition characterized by difficulties in regulating emotion. This difficulty leads to severe, unstable mood swings, impulsivity and instability, poor self-image, and stormy personal relationships. People may make repeated attempts to avoid real or imagined situations of abandonment. The combined result of living with borderline personality disorder can manifest into destructive behavior such as self-harm or suicide attempts. The Health and Human Rights Journal had an article, Mental Health and Inequality, a human rights approach to inequality, discrimination, and mental disability. They said that women diagnosed with borderline personality disorder encounter significant stigma and denial of access to optimal mental health care in comparison with women with other psychiatric diagnoses. This is diagnosed predominantly in females, about 75%. This is a problem that is affecting women today. Women are exposed to more factors that lead to the development of a mental illness. They are more likely to be institutionalized than men. This is a quote by Charles Dickens. The experience of this asylum did not differ, I found, from that of similar establishments, in proving that insanity is more prevalent among women than among men. Of the 18,759 inmates St. Luke's Hospital has received in the century of its existence, 11,162 have been women. A Times Magazine article called It's Not Just Sexism, Women Do Suffer More from Mental Illness says that men have long been equated with reason and women with madness. Such sexism means that women's thoughts, feelings, and behavior are misdiagnosed as insanity. This dissuades women from seeking treatment and leads to a label that negatively affects them. Female gender is also a significant predictor of being prescribed psychotropic medications. Making a change, we need to remove the diagnosis of histrionic personality disorder from the DSM. We need gender-sensitive services. To reduce gender disparities in mental health treatment, gender-sensitive services are essential. If women are to be able to access treatment at all levels, from primary to specialist care, and inpatient as well as outpatient facilities, services must be tailored to meet their needs. We need to ensure textbooks are gender neutral. Previous investigations of gender biases in anatomy or physical diagnostics textbooks have noted that illustrations of male models exceed those of female models. Consequently, this has suggested that medical students may be less familiar with female anatomy and are at risk for developing biases such as the male body being the norm. We need wage equality. Women in paid work receive significantly lower wages than their male counterparts. Relative income inequality, penalizing women and favoring men, is structurally embedded as women typically earn around 2/3 of the average male wage. We need awareness. If women are aware of their options to mental health treatments, they would be more inclined to seek treatment.